G'day, welcome back to the channel. So in today's video, I want to talk to you about the hidden cause of Osgood Schlatter Disease that no one seems to be talking about. And as always, I want to base this off of the things that I find clinically with my patients as a physio and pass it on to you guys in the hope that it does help end up being the missing piece of the puzzle. So the first thing I want to talk about here, in terms of what Osgood Schlatter Disease actually is, if you've got it, you probably know already what it is, but for anyone else who doesn't quite understand, Osgood Schlatter Disease is firmly sort of put under the umbrella of growing pains. So for a lot of our younger athletes who develop knee pain at the front of their knee, particularly below the kneecap, where the bump at the top of that shin, that tibial tuberosity tends to be. The reason for this is in a growing population, in a young growing athletic population, that's part of the leg isn't yet adult bone. It's more of a softer type of bone. So what we tend to see is that when you're growing, that can be a vulnerable part of the mechanical chain that can get irritated and annoyed for a very specific number of reasons. The issue that I have with how we're currently looking at Osgood Schlatter Disease is that you'll often leave a doctor or a physio or another sports medical professional feeling like you need to wait until you've stopped growing before this bone becomes adult bone or stronger bone, and those symptoms tend to resolve. The problem with this thinking is it's not specific enough and it doesn't explain well enough why our younger junior athletes are getting Osgood Schlatter Disease. And one of the main highlighting features of this that I think again gets overlooked a lot is that most people with Osgood Schlatter Disease have it worse on one side more than the other, or it's just physically on one side. If we are labeling Osgood Schlatter Disease as purely a growing pain or growing related dysfunction, it doesn't do a good enough job of explaining why one side is worse than the other at all times. And we know that obviously both legs and both knees are growing at the same rate, so why is one knee sorer than the other, or why is one knee fine and the other one struggling? And what I'm finding clinically is that in order to understand this, we need to take a bigger step back to include more structures in the conversation. And if we do that, what we can ultimately explore and start to look at with our junior population is what's going on with their back. But what I tend to find clinically is that by taking a look further up the chain at a specific section of the lower back, we can start to understand why one particular side has become dysfunctional, and we can start to change that dysfunction to allow this part of the knee to function better and settle down without having to wait until you stop growing to feel better. Now, it may sound a little bit strange when we're talking about the low back connecting to the knee, because the knee's obviously all the way down here and the back's all the way up here, but it is literally physically and anatomically connected in a number of ways. Now, the main thing I'm tending to find here is that there's a section or a chunk of spine at the base of that thoracic spine, the base of your rib cage, top of the lower back. So we're not talking about right down the base of the spine. We're talking about the upper reaches of the lumbar spine at the base of that rib cage, where some of the main nerve roots that associate with the femoral nerve originate from. And that femoral nerve goes down through the front of your thigh into your quads to supply those areas. And what tends to happen is if this section of your back becomes stiff and tight, it can very easily pull a lot of slack out of that femoral nerve and create an increased amount of tension through your quads, through your kneecap, and ultimately through your patellar tendon into that tibial tuberosity that becomes overloaded and irritated most likely in patients who are growing because that section of the knee hasn't quite fully formed yet into a more robust adult bone that we generally get to at some stage. So the really important thing to understand here is that if you're doing all of this work to strengthen your quads and strengthen your glutes and strengthen your hamstrings and your calf muscles, and you're taping it and you're resting it, and the activities that you're doing day to day are impacted by this knee pain, if we're just focusing on the knee pain itself, we're just treating the symptoms of a potentially much broader cause. As soon as you start to direct your attention towards that section of the lower back, you can start to restore that normal loading very, very quickly, allow that tissue to settle down in much faster time than a diagnosis of just waiting until your legs and your body stops growing. So the next thing I want to do in this video is I want to show you how you can specifically find that section of your back that may be connected to your Osgood Schlatter Disease, and then ultimately release that section and hopefully see an immediate improvement in your knee pain symptoms. What I tend to do clinically is I tend to pick on something that that you know specifically generates your knee pain, whether that's running, hopping, jumping, squatting and lunging are generally pretty good ones. Do that first to get a strong sense of how your knee pain feels right now. And then what I'll get you to do is you can take a foam roller, or you can take a tennis ball or a lacrosse ball, whatever you feel works best for you. All we want to do basically is place it in the midsection of your back. If you start at the base of your rib cage-ish, we're going to do this by feel so that you know that you're not missing anything important. And what I want you to do is I want you to not roll up and down here. If you're a fan of the channel, you know that I'm not a big fan of that as a technique with the roller. But if you have your hands behind your neck, I just want you to gently recline back as far as you feel comfortable. Then very, very slowly move the roller up or move the roller down, just looking for areas or segments of your spine in this area that feel stiff, tight, and potentially tender. And once you've found something that feels a little bit stiff, tight, and tender, you can recline back a little bit, you can roll to one side a little bit, you can roll to the other side a little bit, just looking for where the stiffest part of that segment is. And for me, there's a little bit of stiffness here on my left-hand side, so I just want to stay here. I just want to let the foam roller press in. I can recline back a little bit further if I need a little bit more tension or pressure through the area. Take a deep breath in and then relax on the way out to try and prompt this tissue to free up. Trying to get any muscular tightness over the top to release, but we're also trying to sink through that muscle tissue into the spinal joints or the rib cage joints below to get that deeper stiffness, the stiffness that's closer to those nerve roots, closer to that neural tension that may have developed, get that tissue to free up and give in a very short amount of time. And then once you've had enough in that spot, you can move the roller down a little bit lower, just a tiny bit, go looking for the next spot that feels a bit restricted, feels a bit tight and stiff, and then keep repeating that process. And then if you stand up again, recheck your spot, recheck your lunge, recheck whatever movement or activity that you know generates some of that discomfort for you, and then hopefully you'll see that there's an immediate improvement in your symptoms. Now, following on from that, the second thing that I think everyone needs to make sure they're trying here is we need to do some techniques or do some exercises or stretches that free up the quads. Probably the best quad stretch or the best anterior thigh stretch I've ever seen is the couch stretch. So again, make sure that you're doing a pre-test, do a squat, do a lunge, hop and jump, whatever you know exposes your symptoms so that you can feel comfortable that you know exactly where you're starting. And what we want to get you to do is, again, I'll do this on the floor, but anyone can do this on a couch. So if you want to do it in the back corner of the couch here, you want to basically have your foot into the back corner with your shin pointing upwards. We want to get you to have your other foot upwards. And then as far as you feel comfortable, we want to come up and extend as far as you feel you can, looking for some tightness through the front of the thigh. Now again, we want to make this very specific to you. So if you can gently push your hips forward, you can twist your trunk towards one side, you can twist your trunk towards the other side. Go looking for where the position is or the best position is for you that exposes some of that tightness. Some people find that they shift their hips away to take some of the tension off. So really try and shift your hips almost to the other side if you need to, again, to make sure that you're hitting the right spots and getting the most out of this stretch. Wherever it feels tight, I want to get you to tense up that tightness. So that might mean pushing your foot back into the edge of the chair or the back of the couch, depending on where you are. Make that tightness activate. Hold this for about 5 to 10 seconds. And then when you relax, you might find that you can actually go a little bit further back into the stretch, push your hips a little bit further forward, or shift across a little bit more to find the next tightest part of that stretch. And then what we should expect to find again, it should automatically feel a little bit easier than it did before. So it's important to remember that we still need to do the traditional rehab things for this knee pain. We still need to make sure that we're managing your load as best as possible. We need to make sure that we're strengthening your quads, strengthening your glutes, strengthening your hamstrings. We need to make sure we're doing all the things that help you deal with your symptoms. But if we're not taking that bigger step back and checking out your lower back, checking out the effects of that lower back dysfunction, then potentially all we're doing is just treating the symptoms without ever getting to the underlying cause of why that knee has become sore in the first place. And again, I really need to make this clear. We need to try and move beyond this idea that things like Osgood Schlatter Disease and even Sever's disease, which is the same thing for the heel, that they're actually growing related issues. And we don't have to wait until someone stops growing in order to see a resolution in your pain. What we need to do is make sure that your mechanics is getting better. We need to make sure that your back function is optimal enough to support normal knee function for this to go away and stay away long into adulthood. Now, if you're someone who is now an adult and has the same dysfunction, Hopefully this answers one of those long-standing questions of why you are continuing to deal with growing pains even though you finished growing years ago. And let me know whether you found that specific section of your back that is stiff, tight and overloaded, and when you release that, it hopefully makes your symptoms start to feel better almost immediately. If you found this video helpful, please let me know in the comments down below. Consider leaving a like rating down below. Subscribe to the channel if you're new. If you're someone who did find this genuinely helpful, please consider leaving a super thanks donation on the video, which is a great way to help support me and the channel and allow me to keep making these videos going forwards. But with that being said, again, I sincerely hope that was helpful. We'll see you in the next one.